How are MPNs diagnosed? Question will be answered by Dr. Gerds.
All right, thank you very much. Thanks to NCCN and Laura for inviting us to speak with you all today. And as Jackie mentioned, there are a couple of different types of MPNs, or myeloproliferative neoplasms, and part of it is part of the issue is getting down to the root of what is it and which one is it, in fact. And there's a number of tests that your doctor may order in order to get to that bottom of that question. What is it and which kind is it? And those include a history and clinical exam, different lab tests including blood counts and chemistries. There may be some other testing done in order to understand what a person's risk for side effects on treatment or possible complications in the future from their disease. And that might include looking at infectious disease testing, certainly molecular testing or mutation testing, as well as testing for bleeding disorders, and potentially in patients with high-risk disease, doing something called HLA typing, or human leukocyte antigen typing, which is really typing an immune system. It's like a blood type, but for your immune system, and it helps identify a match if a patient is going to undergo a bone marrow or stem cell transplant. The history and clinical exam are probably the most important part of all this. I used to work with this old wise doc who always tell us, you should have 85% of your diagnoses down by the time you're done with your history and physical exam with the patient, before you even start doing blood tests or CAT scans or those kind of things. So I really believe that a history and clinical exam are so important, not only to understand what's been going on with the patient and how they might be feeling, but also you might pick up on subtle clues about family tendencies. Is this happening in multiple family members? And then you'll learn information about other medical problems that individual might be having that could influence how you think about treating that patient. One of the most important parts of this history and physical exam is understanding the symptom burden that might be a result of their MPN. And you'll see listed there the MPN-SAF, or the MPN Symptom Assessment Form, which is a standardized measure to really, again, measure the symptom burden in an individual with a myeloproliferative neoplasm, so the symptoms that the disease is causing. And this is important to not only understand how a patient is feeling, but how, over the course of a treatment, the treatment might be improving those symptoms. We certainly look at blood counts, particularly white blood cell counts, red blood cell counts, and platelet counts, in addition to looking at white blood cell subsets such as blasts and myelometacytes and all those good things. And we also want to look at chemistries, including kidney and liver function. And for patients with anemia or polycythemia, we are often quite interested in looking at different measures that would influence red blood cell production. On the right-hand side, for infectious disease, I generally test in all my patients at least once for a remote history of hepatitis and to see whether or not they've been vaccinated for hepatitis. Because in certain treatments that we use, hepatitis can be an issue, the virus that is. A bone marrow biopsy is an important part of the diagnosis as well for many patients with MPNs. The reasons for a bone marrow biopsy include getting the grade of fibrosis or whether or not there is fibrosis there. Again, fibrosis meaning bone marrow, scar tissue. In addition, we can get a test called Cytogenetics from the bone marrow. And that really looks at chromosomes inside of the MPN cells. And chromosomes are large collections of genes, and sometimes we do find abnormalities in the chromosomes of the MPN cells, which can help us determine what treatments we might want to use. Molecular testing is another word for mutation testing. And certainly we want to rule out something called chronic myeloid leukemia with BCR-ABL testing. That's that first line there. And chronic myeloid leukemia has a very different treatment than the other MPNs. So we want to make sure that that's not the case. Secondly, we want to help aid in the diagnosis by finding the driver mutation, basically the mutation that started all this off. And those typically occur in either the JAK2 gene, the calreticulin or CalR gene, or the MPL gene. And so we'll do testing for those. Sometimes at certain centers, they have access to what's called a myeloid mutation panel, which can check a larger range of genes that potentially are mutated in MPN cells to help, again, aid in prognosis and treatment selection. And lastly, in certain patients who have high platelet counts or might have a tendency for bleeding, we may look at hemostasis labs, and that's a fancy word for bleeding risk labs to help kind of understand why a particular patient might be at higher risk for bleeding. So as I mentioned before, a bone marrow biopsy can be a very important part of getting the diagnosis, as well as some other information to aid in prognosis or determining how aggressive one's disease might be. And bone marrow biopsies are typically done in a part of the bone that's right around the waistline, right where your belt sits. And a needle is inserted into the bone marrow space, and a little sample is taken. And this is a picture to script the kind of showing where a bone marrow biopsy is done. I have a lot of discussions with patients in clinic about whether or not to get a bone marrow biopsy. And I think that's a good conversation you should have with your doctor or MPN specialist as to whether or not I should have a bone marrow biopsy. What kind of information can we get from it and how it might change the diagnosis or treatment of my disease.